This film will help you prepare for your planned hip or knee replacement surgery at the Royal United Hospital. You will have a preoperative assessment before your surgery, so we know you are fit and well enough to have the procedure. This will be online or in person, possibly a combination of both. We will ask you lots of questions about your general health and we will carry out some simple tests.
Joint replacement surgery is elective. It's your choice if you wish to have the procedure, which means there's lots of time to plan for the operation. We know that people prepare to come in for their operation, but we'd also ask you to think about being prepared to go home again. You should prepare your home by making sure it's easy to move around, that any trip hazards such as rugs or coffee tables are moved out the way for your initial return home. Ensure your kitchen is well stocked with food, especially easy to prepare meals such as freezer meals that can be heated in the oven or the microwave. You'll be provided with enough pain relief medication that will last for several days after your discharge from hospital. However, most patients will need to continue to take pain relief for longer. Make sure you get a supply of over-the-counter painkillers, usually paracetamol and ibuprofen if you can take them.
Prepare a travel bag for your stay. We recommend packing a warm dressing gown and some slippers to wear whilst you wait to go into theatre, as getting cold can prolong your recovery time. Footwear should be supportive but ideally slip on and not too tight, as your feet can swell post-operatively. You'll be expected to get dressed the morning after surgery, so bring loose-fitting clothing such as elasticated shorts, joggers or skirts. Don't forget to bring a small wash bag and a towel. If you take any regular medication, please pack 7 days worth. There can be some waiting around, so it's a good idea to bring a book or magazine, smartphone, computer or tablet. Please leave any unnecessary valuables at home, as we can't be held responsible for loss or damage. For 5 days prior to admission, please shower using the Hippie Scrub, an antibacterial soap provided by the pre-assessment team, to ensure the skin is clean as possible and reduce the chance of infection.
It's a good idea to let your family, friends or neighbours know you are having surgery, because they may be able to offer their help and support. Once you have an admission date, you should arrange for someone to bring you in and to pick you up. Research shows you will recover better in your home environment with less risk of complications. You'll be able to go home when you are comfortable and safe to do so. That may be the day of surgery, the day after surgery, or longer if necessary, but you should plan for all possibilities.
Unless the preoperative assessment team have spoken to you about any medications you need to stop before surgery, please continue to take all your other medication as normal. We will do everything we can to make your health as good as it can be for the day of your operation. But if any of your existing medical conditions get worse, or if you develop a new illness around the proposed date of surgery, then you must let us know. We particularly want to know if you develop diarrhea or vomiting, a high temperature, if you have been prescribed antibiotics by your GP, if you develop COVID-like symptoms, or if you have a cut or infection over or near the site of your operation. Knowing about these conditions helps us to know if it's a safe time for your operation to take place.
If you can no longer attend or no longer need your surgery, please let the booking team know as soon as possible to allow them to offer the slot to another patient. The phone number is on your admissions letter.
Please check our current visitor policy on our website to find out if you can bring someone to the hospital with you.